Hi, this is Cristina Medina, a pharmacist recruiting strategist with CVS Health Careers, and you are listening to the Pharmacy Podcast.
Welcome to the Pharmacy Podcast Show. You're listening to the first and only podcast dedicated to the business of pharmacy. You can find all of our episodes at pharmacypodcast.com.
Internos residentes del área farmacéutica. ¿Estás interesado en expandir tu conocimiento y experiencia dentro de Health Dynamic? En este momento estamos buscando a P1 graduados en 2021 y P2 graduados en 2020 que estén interesados en puestos farmacéuticos dentro de nuestra residencia de verano Summer Retail Spanish Immersion Internship a partir del 4 de junio hasta el 10 de agosto del 2018.
Hey, Pharmacy Podcast Network listeners, this is Todd Urey, founder of the Pharmacy Podcast Network. Today is a special day where we're working with a sponsor of the Pharmacy Podcast Network that's returning for 2018. We're so grateful to CVS Health Careers coming back, sharing some of their insights, doing things out of the box, doing things differently to set themselves apart in the industry of pharmacy, to really reach out to soon-to-be pharmacists, people that are dedicated to our pharmacy profession. I like this topic. We're talking about Spanish Immersion Internship. So we're at that time of the year where pharmacy students and pharmacy professionals are thinking about these types of things. And I have two guests from CVS Health Careers, Cristina Medina and Mr. Scott Lason. How are you guys today? And welcome to the Pharmacy Podcast.
Hey, Todd, how are you? Thanks for having us.
Yeah, thanks so much. Doing great. Appreciate it.
So, Cristina, I'm going to start off with you. I want you to set the stage. Tell our listeners, what is the Spanish Immersion Internship? Just give us an overview of this program, because it was very interesting to me when we first started talking about it before we started recording.
Yep, absolutely. So we created at CVS last summer what's called a Spanish Immersion Internship. And the purpose of this is for students who speak some Spanish, maybe they've had a little bit of experience in high school or college, to gain some more experience in speaking Spanish, learning different disease states that are prevalent among Hispanics within one of our retail pharmacy sites, so that they can better help our patients and patients in the community. In case you're not aware, the Hispanic population is growing at a really, really high rate. And what we're finding is that there's not enough healthcare providers that actually speak Spanish in order to serve patients, specifically in pharmacy practice. And so we've created this special internship in order to help that and to help this growing population with being able to have somebody that they can communicate with effectively for their healthcare needs and questions, specifically related to pharmacy. And so this program it's 10 weeks. And it is a paid internship, as I mentioned, within our CVS Health Retail location. And students do get immersed within the Hispanic community, and they get to also learn our CVS intern program, which includes ExperienceRx, which is our training program. And, it's just important to note that fluency in Spanish is not mandatory in order for candidates to be selected or for them to apply. As I mentioned, any Spanish courses that they previously took in high school or college, or even any prior participation in, say, like a mission trip to Spanish-speaking countries, would provide a baseline knowledge in order to participate in this program.
Hey, Scott, what does the typical day or the week in the month look like? And what are some of the non-typical things that these interns are going to do as part of this really interesting program?
Oh yeah, thank you. So it's really exciting for the interns because they are placed in one of our retail pharmacy settings. They do have a pharmacy preceptor there that is guiding them through the internship. And while they're focusing on a normal retail internship in community pharmacy and interacting with patients and technicians, in addition to that, we try to make sure that we get them in front of the patients, especially those that speak a lot of Spanish or only Spanish. And so they're going to, with the support of their preceptor, be interacting with patients, getting more comfortable with them, utilizing medical terminology with those patients, counseling them. And that's kind of the normal day to day. And then anything you would normally do in a community pharmacy around the filling of the prescriptions, making sure the quality assurance is taken care of and the patients are getting what they expect in a timely fashion. Outside of that, some of the unique things they'll do weekly and monthly is special projects around their community. So they'll work with preceptors, or they can find things on their own where they can get out in the community and do things like brown bags with elderly patients, where they bring all their medications in and they can talk to them about them, or they might go out into the public and do some teaching of the patients as well around certain disease states and such. So it's really a unique situation where they're doing as much as they can that they would normally do in their training and development as an intern to become a pharmacist, but they're utilizing the Spanish as much as possible in as many settings as possible to really get more comfortable with that.
As a pharmacist, we know how trusted the profession and the professional is to the community. Part of the trust is that a patient comes into that pharmacy location that they're used to going to in their neighborhood and seeing that same pharmacist or even that same technician and pharmacist team every time they come in. There's that they're building that awareness, they're building that trust. But part of that trust is understanding the culture that you're serving. So pharmacists, you're listening to this show. Pharmacy students, you're listening to this show. Part of being a good healthcare provider is the relationships that you're building between you and your patients. And trust comes along with that is so important. And there is cultural differences for those people that are Spanish-speaking patients. So this is so important. So Cristina, why did CVS Health create this unique internship experience, the Spanish Immersion Internship?
This program was created specifically to really help the patients have that one-on-one person that they can actually feel comfortable with in speaking in their native language. Research shows that when people are ill, they're going to revert back to their native tongue. So having somebody at the pharmacy that understands their language and then can speak with it effectively, or even understands that cultural competency, to your point, Todd, around understanding the things that are unique to a particular culture, just makes that patient feel so much more comfortable. And especially with that trusted healthcare professional who is a pharmacist.
A follow-up question, Cristina, and this is something as you're talking, I'm thinking of the timing of all this and how you guys have really accelerated it. But why did CVS Health decide to grow the program in year 2?
So last summer when we did our inaugural program, we had 20 interns that participated within 7 states. The feedback that we got from them was so positive. We asked survey questions to them along the way, making sure that the program was going as we had designed it. We got their feedback, and they just really felt like this immersed experience helped them so much in gaining understanding of the language and of the culture within the Hispanics. And so we thought, why don't we expand it next summer, coming now in 2018, so we can provide even more opportunities to more interns so that they can actually reach more patients and help their communities.
Scott, what other programs have been offered to your interns to assist them in growing their clinical Spanish skills?
So it's been really exciting to work with partners in the corporate office and throughout the company. And one of the things we did this last year is we partnered with Rosetta Stone and created the opportunity to pilot Rosetta Stone as a way for them to continue to grow their Spanish knowledge and their Spanish fluency, while at the same time then putting it into practice in the stores. So we're excited to continue utilizing that Rosetta Stone process and pilot again for these interns this next summer. In addition to that, we did have a medical Spanish course that we did through a live webinar, and they were able to get on there and spend some time with a professor from one of the colleges of pharmacy who has a Spanish medical course, and really get the opportunity to practice the most common phrases, terms, and really get comfortable in speaking with those patients and make sure those patients will be able to understand and get better health care. And one of the other things that we're doing is to help them continue with this beyond just the summer is we have created our Spanish immersion rotation options. So where we have our stores that are predominantly Spanish-speaking patients, we have the ability to place these students in some of their rotations, both in their introductory years as well as their advanced year, the last year of pharmacy school, so they can continue that immersion process as they move forward.
Yeah, Cristina, I'm wondering, how are these locations, how are you selecting who's going to, number one, how you're selecting the location, but then who's going to lead these interns in their 10-week journey?
The selections of stores are based upon the market and have the concentration of Spanish speakers there. So, for example, we look at the stores that have our support staff and pharmacists that already speak Spanish and the patient population that are Hispanic. And then from there, we looked at which markets could we absolutely teach students and give them that really great experience. From there, we then selected stores and preceptors that will actually be leading the teaching for our interns, as well as the district leaders that are helping to guide the program with all of the objectives that we want to set forth and make sure that the programs are carried out so that the students do get the best possible experience and learning environment.
So there's heavy concentrations of internships in the state of Florida, Texas, California. I'm almost guessing now what the strategy is for CVS Health Careers, but I'd like to definitely hear it from you guys. Scott, what is the reason for this high concentration in these states?
Yeah, it's exactly what you were alluding to. Is there are obviously many Spanish-speaking patients and clients in those states, and we need to make sure that we get the right pharmacist into those buildings to take care of them and make sure that they're taken care of properly, that they have the right consultation. And while these are important states to us, it is interesting that we also have had the opportunity to expand this into other areas of the country where we also have dominant or predominant Spanish-speaking patients, like in Arizona, the D.C., Maryland area, New Jersey, some of the places others may not typically think of having those Spanish communities. And so it is important that we find a way to make sure we take care of those patients long-term. And to your point, that they have someone they can trust long-term within those stores that they can communicate with effectively.
Scott, as you're saying that, that's exactly what came to mind. We're back to that trust issue. We're back to that issue of a patient walking into a pharmacy, feeling stressed out about life, feeling stressed out about what they're going through. It could be a chronic condition. It could be a cold. It could be the flu. Regardless, having these interns immersed in the ability to reach and touch at a personal level these patients that are looking for guidance is so important. This is not the first time CVS Health Careers has done these things. We're talking like Heroes to Careers, and Talent is Ageless Mature Worker Hiring Program, and Abilities in Abundance. So the Spanish Immersion Program is just following up on kind of the promises that you're making to the community. What's really important to teach future pharmacy leaders is looking for those opportunities. Those opportunities are sometimes right in front of you. You just have to be on the lookout for it. So, Cristina, will these interns have the opportunity to get involved in the local communities, and how will they get involved?
Absolutely. Part of the program involves them participating in any health fairs that CVS might be involved in during that 10-week period. In addition, they can do things within their store to actually help their community. For example, blood pressure screenings. They can help with immunizations depending on the state and the regulations for interns being able to administer immunizations with a pharmacist, et cetera. But oftentimes they're able to even do over-the-counter products, education within their stores to really help the patients in selecting products that they might be familiar with from their country that we have available at CVS for sale.
Scott, what kind of feedback are you getting that you received from last year's Spanish Immersion Interns program? What are the interns saying?
It's been really exciting to get their feedback, and we've been reaching out to them throughout the year to learn from them and help to make this year's program, even better than last year's. And they've been really excited. Many of them have said that it's set them in a path to want to be placed into one of these stores when they graduate and get licensed as pharmacists. It's been extremely positive, and many of them have even asked if they could do the internship again this summer or be involved in some way, maybe as a mentor to the new interns or something. So we've been really excited by the feedback they've given us, and meeting them in the schools and interacting with them has been extremely positive and beneficial.
Cristina, what CVS Health leaders will interact with the interns during this internship program? What opportunity are they going to have to connect with other leaders within CVS Health?
This internship really provides a great networking opportunity for them and to learn some management skills from other leaders. So directly at their store, they will be working with the pharmacy manager, who is their preceptor. In addition to that, they'll be working with the district leader, the university relations managers, our team, which are the pharmacist recruiting strategists, the HR team, in some cases loss prevention, so that they get a really holistic view of our business and see the impact that they would have as future leaders within CVS. So it's a great opportunity for them to not just learn again about the culture and different dynamics within the Hispanic population and the different intern programs that we have within the store, but also those management pieces that they might not get exposed to otherwise.
So the $1 million question is for you, Scott, and that is, I'm listening to the show. I'm on my way into work. I'm on my way to an internship. Even I'm on my way to class. I'm a upcoming resident or even a P4. So how does a CVS Health intern apply, and how do non-CVS Health interns apply for this really interesting program?
Yeah, so we're excited. We've been receiving many applications, and those who currently work for CVS Health have access to our MyHR program, where they can go in internally and apply through MyHR. And we have sent all of our interns emails with specific instructions on how to apply. But if they're not sure, they can go right to that link in MyHR and apply, searching for Spanish immersion, and it'll bring up all the possible options to them. For those who don't currently work for CVS Health, we need to take them through a process of gathering some information. And we do have a CRM link that they can go to. It's a web address they can go to. And we have sent that data to the deans of all the pharmacy schools in the United States. And the deans have access to that. Or they can reach out to their local university relations manager to gain access to that.
Any of the show notes, any of the links that are important for this podcast will be in the show notes. So if you're driving, you're listening as you're exercising, don't worry about it. You can come back later and we'll make sure that you have the information to reach out to the CVS Health Careers team. Cristina and Scott, thank you so much. Kicking off this new series, CVS Health Careers always makes things that much more exciting for upcoming pharmacy future leaders. What a great way to kick off the new year, 2018, and we look forward to the rest of this series. And thank you guys so much.
Thank you very much.
Yeah, thank you for this opportunity. We appreciate it.
You are listening to the Pharmacy Podcast Network, special sponsor CVS Health Careers, in talking about the Spanish Immersion Internship Program. And we thank you for listening to the Pharmacy Podcast.